Welcome back. I'm Dr. Kimberly Madison, a doctoral prepared nurse practitioner and one of your co-hosts for the Mela Initiative podcast. This is one of our little segments that we call One Topic at a Time. And that's when I come in and talk about one topic at a time. Today, that topic is going to be blood work. I was recently listening to a YouTube video, and the question came up about blood work and how often you should get it. And so I thought I would come on here and talk about it because it's a very, very, very popular question in the hospital. People always want to know why we're getting their blood so often and what we're looking at. So let's start with outpatient. So you're, let's say you're a healthy person, you have nothing going on, and you have a job and you have health insurance. For most people and most health insurance plans, they cover certain visits for free. So meaning 100, because you're paying into the plan, they're going to cover it 100%. So, we always talk about primary care, which is preventative care. And part of that means screening you for other risk factors. Screening can include just asking you questions about your family history. So if we find out that one of your parents has high blood pressure, that's going to put you in a higher risk for getting high blood pressure too. We might do blood work. If it looks like compared to last year, your cholesterol has been increasing, you're getting older, also your weight has been increasing. So now your risk for things associated with high cholesterol is going to increase. So we're screening you for that. We might encourage you to, you might want to lose weight or stop eating seafood with that has a lot of that's associated with shells because that's higher in cholesterol. So things like that we might screen you for. And so let's talk about your blood work. So basically, if you have health insurance and you're paying into it, definitely check your plan online, which is probably the fastest way. You can always call them if you feel more comfortable. But it'll let you know what they cover. And typically they cover one annual physical exam as well as the blood work associated with that. So in the physical exam, your provider will look you over from head to toe, listen to your lungs, look at your eyes and your mouth, listen to your belly. They might have you do movements, test grip strength, check your balance. You'll typically wear a gown for that so they can look at your skin as well. So yeah, that's like your physical exam. And so they'll order some blood work. We'll usually collect a urine sample that allows us. So urine's supposed to be sterile. There's not supposed to be anything in urine. So if we do a urine test and there's anything in there, including drugs, protein, glucose or sugar, or white blood cells, then we have a concern that there might be something else going on. And we also will do urine tests for people who are on certain medications because a lot of medications get metabolized through the liver or the kidney. And we want to make sure that they're not infecting those organs more than we would like. So the blood work. So we can't just look at you on the outside and see how something's doing. We have to go on the inside. And a couple ways we can do that is through blood work as well as through imaging. So x-rays, CT or CAT scans, MRIs, ultrasounds, PET scans. So with your blood work, we're usually going to use your arm. We can use anywhere on your arm or you have blood vessels everywhere. So we can use anywhere on your arm or your hand. In the hospital, sometimes we use your foot or your leg because what happens is your blood vessels, after they get kind of beaten up over time, it makes it really difficult to get blood from there. So if you've used drugs, if you've been on chemo, if you have liver or kidney problems, with age, those can make it, or if you're dehydrated, those can make it really, really hard to get your blood. And we might have to stick you more than one time. We don't want to stick you more than we have to. We don't enjoy causing pain or making people really anxious or nervous about, just keeping on top of their health. So if you know you're gonna get blood work, the day before, hydrate. Clear fluids, at least 2 liters. That's what you should have at any time. But if you live in a very humid place, if you work out a lot, if you're sick, if you're on certain medications like diuretics, then those 2 liters might not be sufficient. If you're a kidney patient, you might be on, or a heart patient, you might be on restricted fluid intake. You might not be allowed to even drink 2 liters a day. But yeah, if you know you're going to get your blood work the next day, just drink 2 liters of fluid. And you can even see your blood vessels. If you can't see them, then it might be hard for us to find them too. But yeah, we can use any part of the arm, the hand. Sometimes we'll get them up here in the shoulder. Because even if you're really swollen, or if you have a lot of body fat, it just makes it very hard. It makes it very difficult. And we have different devices that can make that easier to see, different lights and things that we can go see right through the skin, and it'll highlight those vessels. So put a tourniquet on the arm, which just allows us to trap that blood in one place so that it accumulates in one place and we can get all the tubes that we need. Each tube might look at something very different, or it might go to a different lab altogether. So that's why we need to get so many tubes. So let's talk about the blood work that we're going to get. So your insurance might pay for just one set of blood work a year if you're healthy. Now, once you start getting diagnosed with things or start being prescribed certain medications, you're going to have to go back more frequently. It just depends on what that medication is. And then also, depending on what it is you're actually trying to check, it might not be worth it to go back multiple times a year, or to know exactly when to go back. Because with certain, especially if you are on certain medications, depending on how many doses you take, we want to check it at that point before we continue further. So you really have to talk to your provider about that. So this first kind of blood work that we're going to see really common and that your insurance is likely to pay for is called a CBC, or a complete blood count. When we're looking at white blood cells, that helps us monitor for infection. And then there's different kind of white blood cells, which lets us know what kind of infection you're having, if it's an allergic reaction, if it's bacterial, viral, fungal, parasitic, if it's a new infection or it's been there for a while. Then we look at your hemoglobin and hematocrit. That helps us monitor for anemia, very common in our kidney patients. One of the functions of the kidney is to help produce red blood cells. So when an organ can't do its job, we're going to see the complication associated with that. And there's medications to help with that. So we look at risk for anemia, which is also common in our Black and brown communities. One, because of diet. Diet is the most common reason, and iron deficiency is the most common reason, but it's so preventable. You just have to eat the right foods, and you can take iron supplements. One of the complications with iron supplements is it can cause constipation. There are different forms of iron that might decrease your risk of constipation. You can also combine it with vitamin C, which also helps your body absorb iron much better. So if you do take iron, it's great to combine it with like oranges or pineapples, anything high in vitamin C, which is typically in the produce section. And there are some medications that are formulated so it has iron and vitamin C in the same tablet. So we're looking for anemia. And with anemia, the symptoms of that are like you might feel cold all the time or short of breath. And what I see is just most people don't take it seriously enough, and they'll just be like, yeah, I've always been anemic. That's just because they've always not followed the recommendations. But it's something that's quite easy. And even I've talked about before, I'm on a plant-based diet. That does put me at risk for being anemic, but I haven't been for quite some time. So I was more anemic before I became plant-based than I have been since. And it has to just do with what you're eating. So things high in red meat, beans, cooking with lentils, one of my favorites, cooking in a cast iron skillet can all help increase your iron intake. And that's something you can easily Google. And maybe we'll talk about anemia in the future. We have an episode coming up on sickle cell anemia, a little bit different conversation, but just want to put that out there so you can follow. So another one we might look at platelet count, which can be very concerning for people on blood thinners, or even chemo, because chemo kind of destroys your red blood cells, white blood cells, and your platelets. And that's how those patients are at risk for things like infection, anemia, and bleeding or clotting disorders. And let's see. So we've looked at our CBC. Then we're going to do a chemistry or a basic metabolic panel. Now we're looking at your electrolytes. So that's sodium, which can be affected by dehydration, potassium, which can be altered, particularly if you're a kidney patient or on dialysis, phosphorus, calcium, magnesium. Particularly our magnesium and potassium can really affect your blood rhythm, your cardiac rhythm, the way your heart beats. And so we'll look at those numbers very, very closely, especially in the hospital. So we might do replacements to prevent any complications associated with that. And then we'll look at your kidney function, which can be a sign of whether you're dehydrated or not, the effect of certain medications, the impact of uncontrolled high blood pressure, particularly over an extended period of time. And so we might give you fluids for that, and you might be on those fluids until those numbers are corrected. There are a number of other things that can affect your chemistry, but those are some of the most common ones that we see. Look at your liver function, which can be altered by something like a hepatitis or even certain medications that you might be on, and alcohol intake. And then we're talking about outpatient. Your annual blood work might include a hemoglobin A1C, so we can monitor your risk for diabetes. And then, so if you are diabetic, you'll get that checked more frequently, typically every 3 months or so, because that's how long it takes for the red blood cells to turn over, which when you have diabetes, you have too much glucose or sugar attached to your red blood cells. And so those blood cells have to technically die or turn over, be eliminated to get a whole new set of blood cells, so we can see how well you're managing your diabetes. We could check an iron panel so we can get a better close-up look at what's causing your anemia, because there's different causes of anemia. Iron deficiency is just one of the most common ones. We can look at your thyroid function, and that can get adjusted if you're on a medication. We're altering the dose, figuring out the right dose for you. You might come in more frequently for that one. Depending on your provider and where you live and where you're from, might check a hepatitis more frequently. Hepatitis B. Vitamin D, definitely a good one to check. The only way to know how much vitamin D to take is to get your blood drawn. It's really the only way, because a lot of times they'll recommend like 1,000 or 2,000 international units. But even when I was taking that consistently for a year, I still did not meet the therapeutic level. And so only way I knew that was through my blood work. And then, of course, you can do your, you can get blood work done. Those are the most common things we're going to check for. Oh, and the lipid panel for cholesterol. Those are the most common ones. So CBC, or complete blood count, chemistry or basic metabolic panel, thyroid, iron, lipids, hepatitis, and the urine sample. Those are going to be your basic ones. And then you can always add on things based on your risk, your lifestyle, your medications, diagnosis, family history, upcoming procedures. And I think that's all. I think that's it. So yeah, so basically annually, your insurance will cover that. Anything more than that requires a diagnosis, or for you to pay out of pocket, either 100% or like a percentage. But one great thing that you can do, there are a lot of companies online or also like CVS where they can do blood work for you. It might not be as thorough, and it might not be diagnostic. So like CVS, for instance, you can go to their website. They have a different types of labs you can order, like wellness and things like that. And they'll tell you exactly what's included in that order. And you can go to CVS and they can draw your blood for you. But I know that sometimes based on those results, they still might refer you to primary care to follow up, just because of the way they collect the blood. You just need a more thorough test to make sure what we're seeing is actually accurate. So if you don't have insurance, or for some reason your insurance doesn't cover it, that's an option that you can look into. So yeah, I think that's all I have for now. So if you have any questions about this, what I've talked about today in terms of like just routine blood work or anything specific, just shoot us an email, or if you feel comfortable, you can leave it in the comment section. Okay, let me just run over the blood work in the hospital. So we'll look at all those same things, mostly just CBC, the complete blood count, and the chemistry or the basic metabolic panel when you're in the hospital. We might do some anticoags, which it lets us monitor your risk for bleeding and clotting. If you're on a particular medication, we might be monitoring that like a heparin. If you're having chest pain, we might order labs to look at the stress on your heart. Lots of urine in the hospital, looking at that to see risk for infection, drugs, things like that. And what are some other ones that we might do? Those are like the most common ones. So basically, when we talk about AM labs in the hospital, we're talking about your CBC, your complete blood count, or your basic metabolic panel. Mostly everyone's getting that every day. And that's just so that we can see if your body is responding to the treatments. Because like I said, a lot of medications get metabolized through the liver and the kidney, and we just want to make sure that they're responding, tolerating that appropriately. And yeah, I think that's all I have. So that was one topic at a time. Today, that topic was blood work. And I thank you for watching.